I spoke to Bill Gates this week. I asked him to explain what Act A does and what it has achieved in that first year.
Well, as the pandemic struck a little over a year ago, there was a realization that this was a global problem and that we needed to orchestrate resources on a global basis. And so particularly the UK, France, and Germany came together with other actors like the WHO and our foundation and said, okay, what are the vehicles we can use? CEPI was there to do vaccine research, Gavi to buy vaccines, Global Fund for therapeutics, including oxygen. And that's what ACT A is. It's taking all of that additional resources and coordinating it on a global basis. And so it was super valuable that we did that. Of course, because we didn't prepare for this pandemic nearly like we should have, we've been learning as we've been going. But I'd say the good news is that partly because of the ACT A efforts, partly because of U.S. R&D money, we have the vaccines, and we can see the end will come for this pandemic.
What would you say the big success has been in the 12 months?
Well, the therapeutic area has scientifically not yielded as much as we would have liked. There was a trial in the UK, the FAIR trial, that we helped fund, that came up with dexamethasone early on as a late-stage treatment. And fairly quickly, people realized that having oxygen was important. But we haven't had any dramatic therapeutics, unfortunately. The vaccine space is been amazing. Not only did we get them very rapidly, now the volumes are getting up, and we're using factories in India and other places as a second source. So we're not just relying on the company that invented the vaccine, but for the first time ever, transferring exactly that vaccine into factories like at Serum or BioE to get the capacity up so that, we want to vaccinate certainly all the elderly in the world, and in most countries, we want to get to over 80% vaccination. And so that's, kind of mind-blowing, particularly when we did very little to prepare in advance.
And in terms of that, there's been some speculation that the changing intellectual property rules and allowing these vaccines, as you say, the recipe for these vaccines to be shared would be helpful. Do you think that would be helpful?
No.
Why not?
Well, there's only so many vaccine factories in the world, and people are very serious about the safety of vaccines. And so moving something that had never been done, moving a vaccine from, say, a J&J factory into a factory in India, that it's novel. It's only because of our grants and our expertise that can happen at all. The thing that's holding things back in this case is not intellectual property. There's not like some idle vaccine factory with regulatory approval that makes magically safe vaccines. You've got to do the trials on these things, and every manufacturing process has to be looked at in a very careful way. There's all sorts of issues around intellectual property having to do with medicines, but not in terms of how quickly we've been able to ramp up the volume here. I remember how shocked people were when we said we were going to do second sources in these developing country factories. That was a novel thing, and we got all the rights from the vaccine companies. They didn't hold it back. They were participating. I do a regular phone call with the pharmaceutical CEOs to make sure that work is going at full speed.
So it's not that's slowing it down. More money would help. More vaccines physically would help as well, wouldn't it? How hard is it to get the countries that have the vaccines? And obviously, here in the UK, we have enough to vaccinate our population 5 times over. What are your feelings about that?
Well, over the balance of the year, the US, the UK, and others will be able to make sure that the vaccines are now going to the developing countries. Because many of the vaccines worked, although we're looking at, some of the side effects now and making sure we can treat those and that they're very rare, that good news means that we will be able to supply others. And The other good news is that the actual death rate from this epidemic in the poorest countries has actually been quite low. And so the places where, you want to get everyone over 60 vaccinated, like South Africa, Brazil, that will become a priority just in the next, 3 or 4 months is when the U.S. will move into that excess position and take these Act A resources and use them to get those vaccination levels up as fast as we possibly can. It is true that there's been about a 4-month gap that, depending on what happens with J&J, could be over 6 months. Typically in global health, it takes a decade between when a vaccine comes into the rich world and when it gets to the poor countries. So in this emergency, partly because of the second source agreements, all the cooperation, the government money, where the UK, France, and Germany actually pulled Act A together with some other actors like the WHO and our foundation, that's made a difference. Because we didn't practice, it's clear that understanding variants and understanding how quickly you can do the regulatory stuff, when this comes up again, we could be a lot smarter. People didn't invest enough in this risk, forming CEPI that the UK and Wellcome and our foundation and others did was one of the few things, and it's only a few percent what should have been done to really practice, do simulations, understand how quickly you could get the diagnostics ready. And so, I hope we keep in mind that we do need to invest in being ready for the next pandemic.
But are you concerned about the imbalance that there currently is between some of the more developed countries and the numbers of vaccines they have and the numbers of vaccines that are available and are going to the less developed countries?
Yes, the reason our foundation funded Gavi, which the UK is also a huge backer of, is to deal with these unbelievable health inequities. And as I said, in this case, it's about a 4 to 6 month delta. That's not fair, but that's actually doing very well. Given that the funding that was provided, the fact that the rich countries have somewhat prioritized themselves, that's not completely surprising. We don't have world government that sits there and ignores the U.S. R&D money or UK R&D money and overrides that, because the fact of getting elderly people vaccinated in the rich countries, which actually had the pandemic worse than most of the developing countries, that was a good thing. The fact that now we're vaccinating 30-year-olds in the UK and the US, and we don't have all the 60-year-olds in Brazil and South Africa, that's not fair. But within 3 or 4 months, the vaccine allocation will be getting to all the countries that have the very severe epidemic. And so Act A, it doesn't get a perfect grade, but it does get a very high grade that the second source deals did happen. And now, we're going to get to the point of equity. The U.S. did not participate in the multilateral activities. The Trump administration stayed out of that. That made it harder and put a lot of burden on France, Germany, and the UK and others.
Has it got easier since Biden's arrived?
Yes, it's changed dramatically. He unblocked the $4 billion that the Congress had appropriated. He rejoined the WHO. And now, the U.S. and the UK will be the first countries that will have the excess vaccines and will, use these mechanisms to get them out to where the death rate is the highest.
We've got the G7 coming up. What are your hopes for it?
Well, I'm very pleased that the UK is making pandemic preparedness, both finishing this pandemic and thinking through what happens next. It's a real priority. And in fact, my wife Melinda's working with the Prime Minister on the panel that'll present what that template for future preparedness looks like.
Because you've been talking about the fear of a pandemic for a long time, and people haven't really listened. In a sense, COVID-19 has helped you in that it's helped people realise the importance of the message that global health is this crucial thing, isn't it? I mean, in a way, do you think that COVID-19 will open up the kind of organisations like yours to more funding, to people being more open and receptive to your message, or do you think we'll all forget about it once it goes away?
Well, I'm worried that we'll forget about it. You know, the Ebola epidemic was the time I thought people would be interested, and that's when I was out talking about what we needed to do. CEPI was created, which has helped with some of the R&D, but that was only, say 5% of what it would have meant to be fully prepared. The UK, Wellcome, and ourselves were among the backers of that CEPI effort that has contributed along with the country-specific R&D money. I do think because trillions were lost, that this generation will remember this, and we will do simulations, and we will look at, okay, can you make our mRNA cheaper and have a network of factories all over the world? Not in every country, but enough so that the capacity could go up, 5 times faster than it did this time.
You did say that you thought we'd be getting back to normal by the end of 2022, completely back to normal, I believe were your words. Do you still think that? Are you still hopeful of that time frame?
Yes, I am. There's still some questions about how broadly the J&J vaccine will get used, that if that's accepted, would be very beneficial. But, some of the rich countries, including the US and the UK, even this summer, will get to high vaccination levels, and that'll free up so that we're getting vaccines out to the entire world in late 2021 and through 2022. And so we won't have eradicated this disease, but we'll be able to bring it down to very small numbers by the end of 2022.
Here in the UK, we haven't given as many vaccines, I suppose, as you and others would like to the developing world. We're also expecting cuts to the foreign aid spending. What would you like the UK government to do more of to help?
Well, the UK government, was great in terms of realizing that vaccines were important, supporting CEPI, supporting Gavi, this Act A thing, which it's the anniversary. The Prime Minister was key to pulling that together. He's using the G7 meeting. For us, the quicker the UK can get its aid level back up to the 0.7%, the better. The needs there are dramatic. UK aid, the voters there should be very proud of the impact that has. It's been the strongest proponent of getting behind vaccines and making sure we eradicate polio. And with the cutbacks, we won't be able to do as much. So I hope that gets restored, because it is of critical importance.